The answer is relatively simple in that if blood glucose levels are reduced, less insulin is produced, the pancreas is not stressed and the risk of diabetes developing is removed. Hi folks, Dr. Mark here again. Today we're going to talk about a disease that's becoming increasingly more common in dogs and how we can treat that with nutrition, and that disease is diabetes. So diabetes can basically be described as involving the interaction between glucose and insulin. The energy that a dog needs can be provided by glucose being used by the animal cells. Insulin is critical for this to happen, essentially enabling the glucose to enter the cells. A simple way to think of this is that insulin is the key to let glucose into cells. Now, when insulin levels are insufficient to allow glucose to enter the cells, it builds up in the blood. The pancreas plays a vital role here as it's responsible for producing insulin. Therefore, if it's not working correctly, a dog can become diabetic. Now, in dogs, as in humans, there are two types of diabetes, type 1 and type 2. Type 2 diabetes is usually due to dogs becoming overweight or obese, in addition to consuming too much processed carbohydrates. With this type of diabetes, dogs are still able to produce insulin, but the bodies become resistant to it because basically there's too much sugar coming in. Type 1 diabetes, in contrast, is when the pancreas of the dog fails to produce insulin appropriately. This means that glucose can't get into the body cells to be used as energy. At this point, the dog will require a lifetime of insulin injections to enable the glucose to enter the animal cells. Evidently, preventing diabetes in dogs is really important for their health and well-being. Although there are several reasons for diabetes developing, including being genetically predisposed, having immune-mediated disease, and taking certain medication, diet can play a pivotal role. Diets that are high in processed carbohydrates can lead to increasing blood glucose, in turn resulting in a greater insulin production to drive these concentrations down. Consequently, this places stress on the beta cells of the pancreas, which produces insulin, and, if persistent, will lead to them reducing production with eventually becoming exhausted. The answer is relatively simple in that if blood glucose levels are reduced, less insulin is produced, the pancreas is not stressed, and the risk of diabetes developing is removed. So what aspects of a diet can help this be achieved? The first step is to reduce the carbohydrate content of a diet to a minimum amount of approximately 3 to 5% on a dry matter basis. The source of these carbohydrates should be unprocessed and fibrous, with certain fruits and vegetables being appropriate. Next, the protein content of a diet should be sufficient to ensure the numerous functions the macronutrient facilitates are optimal. A protein content of 30 to 35% dry matter basis is suitable in this case. The final macronutrient providing energy to a dog is fat, with 65 to 75% dry matter basis, the target that we're aiming for. Fat has a crucial role in reducing the concentration of glucose by essentially switching off the reliance a dog has for glucose. This is achieved due to a high-fat diet and the low carbohydrate content of that diet, with the fat being the major source of energy. When this occurs, the liver undertakes a chemical process whereby energy is regulated and ketone bodies are generated from the breaking down of fatty acids, serving as an alternative fuel source. In essence, this means a dog's body is burning fats instead of glucose for energy. In addition to this, a diet with fats as a dominant macronutrient can also synthesize glucose from fat in the blood of dogs, called triglycerides. It achieves this by breaking down triglycerides into 3 fatty acids and glycerol, with glycerol providing the glucose for energy. Moreover, certain amino acids from proteins such as alanine can also be biosynthesized, resulting in glucose. Although a dog can still have glucose concentrations from these processes, it is important to understand that these are still much lower and much more regulated than if a dog is fed a highly processed, high carbohydrate diet. In summary, the rates of dogs developing diabetes is an increasing problem, with elevated glucose being a key factor. Nutrition can play a vital role in both reducing the risk of this disease developing and also potentially being a therapeutic aid in treating it. This is achieved with an avoidance of high carbohydrate diets that have undergone major processing. In turn, this should be replaced with a low, unprocessed carbohydrate source with a naturally high fibre content. A moderate protein content should then be added to this, with dietary fat being the prominent macronutrient. A good example of this would be bones and cold products. Diets of this composition negate high glucose concentrations with less insulin being required, reducing any stress on the dog's pancreas, all factors which are highly beneficial in diminishing the dangers of diabetes developing.